Welcome to everybody. Hello, my name's Rob Tighe. I'm a faculty member in the Duke School of Medicine and director of the Duke School of Medicine Climate and Health Research Initiative. It's my distinct pleasure to welcome you to today's symposium on health reform and climate change. We're excited to have an amazing group of speakers and panelists here today to focus on this really important topic. To start off with, this event would not have been possible without funding from the Duke Climate Collaboration Symposium and support from the Duke Climate Commitment, the Nicholas Institute for Energy, Environmental and Sustainability, the Margolis Institute for Health Policy, and the Duke School of Medicine. Special thanks goes to my fellow organizers, Drs. Mark McClellan, Robert Saunders, and Jen Lawson. Additionally, this event would not have come together nor have been possible without the hard work of Matt D'Ambrosio, who spent countless hours working out the details and helping to keep us organized. We can't thank Matt enough, and I'd like Matt to stand briefly so you can acknowledge him with a round of applause. Finally, I'd like to thank the speakers and the panelists for giving of their time and expertise today, and for all of you all who are in the audience and who will make this an exciting and engaging day. I'd like to open with why we're here. The evidence is clear that our climate is changing. We can see it in front of our eyes. We're already seeing effects such as prolonged heat waves, episodes of extreme heat, increased frequency and severity of wildfires with consequences to air quality, droughts impacting our ability to grow food and thus threatening nutrition. And even locally, we're experiencing more severe storms and hurricanes that are ending up in places like the mountains of North Carolina, where we don't normally expect to see hurricanes. And though these weather events are clearly impacting our environment, we don't always realize the impact this has on health. Both our health, the health of our communities, and the systems that provide this health care. Climate change, in the end, is a threat to us and our health. Therefore, to protect health and the health of the communities we serve, we need to consider how climate change creates health threats and identify opportunities to limit, mitigate, or prevent these effects. However, these climate and health impacts are occurring at a time where health systems are already financially stretched and have limited resources to devote to this problem. Additionally, we're facing rising and unsustainable healthcare costs and healthcare systems that already struggle to provide care oriented towards the prevention of disease and heading off complications. Climate change is only going to worsen the stresses on these burdened health systems and further hinder providing effective care. Consequently, this is an incredibly complex challenge. It will require bringing together diverse expertise to develop new information and tools that will support solutions to these complex challenges. Implementing these solutions will need new and creative policies to encourage activities that mitigate effects, preserve health, and promote resilience. We'll also need data that supports the efficacies of these policies and refines them to maximize effect. That's why events like today are so absolutely critical. Climate change is not a singular problem to health, therefore there's not a singular solution. Only through multi-pronged efforts can we arrive at the impact that we need. We also need to hear from many voices. Climate change is not just something that exists in the zeitgeist of academic medical centers and universities, but is rather something that will impact us all. Policies in their effort need to consider the communities and their needs, while ensuring that their voices are a central part of the work and the solutions. For healthcare, what we hope to discuss today is that it's not simply a choice between spending more on healthcare, many believe is already too expensive, or asking healthcare providers and workers to do more, but rather to make near-term progress on providing healthcare that contributes less to global warming is better able to meet the challenging risks from climate change while also making health systems more sustainable and resilient. I hope you will see this challenge in the ethos of the sessions today. We cover topics from how personalized care can address emerging health threats, to how we can develop more sustainable and resilient health systems to handle future climate challenges, and how health reforms can lead to healthier and more resilient communities. Additionally, there'll be options to directly engage with speakers at lunch to consider the topics in more depth. Hopefully, this will lead to not only information exchange, but also develop collaborations and engagement that can drive future efforts. So I hope today is an opening of a much needed conversation. I encourage the audience to think deeply and openly about this topic, raise questions to the speakers and panelists, and above all, for all of us to have humility in our own opinions and beliefs. All things should be on the table as we consider how to preserve health of both individuals and communities in a time of immense change and challenges. With that, I would like to open the symposium. I'm excited for a day of exchanging information, ideas, and expertise that could lead to new policy considerations and actions. Thank you all for coming, and I hope this is a thought-provoking day.